Okay, we are going to go ahead and get started. Again, thank you for joining North Kansas City Hospital's Health Screening Talk. Today we have Tina Wilson with us, and she is going to be going over all of the ages that you need to know what to do. So I do need to let you know that this is being recorded and it will be posted to YouTube later. You can ask any questions that you have throughout the talk, and you can do that in the chat or the Q&A. We will be answering those at the end of the presentation. So, Tina, I'll hand it over to you.
Thanks, Shanna. So my name is Tina Wilson, and I'm an occupational health and wellness nurse with North Kansas City Hospital, and I work out in the community. I do a lot of wellness programs for employers, which means we help their employees with all sorts of preventive measures, everything from blood pressure clinics to weight loss workshops to I don't know, digital wellness portals, you name it. We do all sorts of preventive measures to help people be well. Wellness is a passion for me, and I'm really excited to present or make tonight's presentation to you. It's called Health Maintenance in Your 20s, 30s, 40s, and Beyond. And I'm going to try to see why I can't advance my presentation. Here we go. Anyway, let's start out by defining what health maintenance is. The definition is activities that preserve an individual's present state of health and that prevent disease or injury occurrence. And one of my favorite figures in history, Benjamin Franklin, coined a really good phrase for what we're going to be talking about tonight and why it's important. He said, "An ounce of prevention is worth a pound of cure." And so in a nutshell, he said he summed it up for us. So we're going to be looking at a variety of things that you need to be aware of regarding your health, screenings that you need to have, conversations you should have with your physician, and immunizations that you need to keep up with throughout your lifespan. And it's a little different for different age brackets, but it's all really important. And then I'm going to sprinkle, just a few highlights about diseases or, an illness or a screening, just to kind of make it a little bit more interesting, because some of this can get pretty dry. So we're going to break it down into 3 different categories, and we will begin with the 18 to 39 years of age bracket. So I have a column for recommendations for women and a column for the men, and then I'm using the in-between section to address both sexes. So, we go to our doctor every year, and a lot of times, we don't know what to ask, or we don't know what he's interested in knowing about our health, but I'm just going to kind of run through some of this stuff so you can make this top of mind and you can ask questions. And these are important factors that, you should keep an eye on. But a lot of times people don't know how frequently they need to be addressed. So in general, your doctor is going to always look at your height, your weight, your BMI, and it's also a good time to talk to them about tobacco and alcohol use, also to discuss depression or mental health conditions, and to also have your skin looked at and discuss colon health. Those are some just general things that you should always address. Blood pressure, you get that taken when you go to your doctor. It's recommended that you get it taken at least once every 2 years, and cholesterol should be checked at least every 5 years. And diabetes, some people run the risk for diabetes for a variety of different reasons, but that should be checked every couple of years. And dental cleanings, that's something that we kind of overlook, but it's very important to have your teeth cleaned at least once to twice a year, and have your doctor look at your mouth. Also, it's important to have eyes examined every couple of years. So regarding women's health specifically, when you reach 21 years of age, you should be getting a pelvic exam and a pap smear at least every 3 years. And if you're 30 years of age and older, you can get pelvic with an HPV that's normal. You can get those exams every 5 years. Leading up to the age of 25, you should be having sexually transmitted infection screenings, and this includes conditions such as chlamydia and gonorrhea. And at about the age of 40, you're going to begin to get some mammograms. And if you have a family history, it may be sooner. But these are just some very general recommendations. And this is, I want to stress that these are very general rules, and it's important for you to have these conversations with your doctor about what's important to you. Talk about your family history and some of the risks that you're running to see how frequently you need to have these screenings done and at what age. And immunizations are something we kind of overlook. I mean, your doctor's office will probably remind you, but just for your reference, in this age bracket, the HPV vaccine is available, and that's recommended between the ages, well, about 18 to 26 and possibly younger for both men and women. And I realize like that is kind of it's sort of a difficult conversation because a lot of people don't want to think that their children are, having sexual relations, but this can protect against a lot of the serious forms of HPV that can lead to cancer down the road. So it's something you do want to address. It's also important to get your flu shot every year and also get a Tdap booster at least every 10 years, and maybe even more frequently if there's a new baby being born in the family. And then you should also consider getting the chickenpox vaccine. So I'm just going to kind of highlight the human papilloma virus because it's related to that HPV vaccine. And these are just some interesting details about this condition and the vaccine. So between the ages of 11 and 12 years of age, 2 doses are recommended, and 15 years and older, 3 doses. And up to 26 years of age is when I think that they're giving it. Again, it's a conversation to have with your doctor to see if it's a good idea. So just some facts about the human papilloma virus. It's an STD, and it's the most common STD. A lot of times it's something we're not even aware we have. It affects more than 80% of the population, and the HPV virus is a group of more than 100 different viruses. It's not just one, but there's a lot of different ones. Some cause visible conditions like genital warts that you can actually see, and others are invisible. And so if you get a pap smear, they may detect HPV. And some of those 100 viruses, again, some of them can cause some very serious problems down the road, such as cervical, penile, anal, oral, and throat cancers. It is contracted through sexual contact. And again, it's important for women to get, pap smears and see their gynecologists to screen for that. And unfortunately for men, there isn't a screening to see if they have it or not. Maybe someday, but women get screened for it these days. And a lot of times people will get HPV, but it kind of goes away on its own. It just sort of like the body takes care of it. The immune system just resolves the infection in the body, and it goes away. So what are some symptoms of HPV? Again, most of the time it's silent. Women can have it, and boys. I mean, men and women. This affects both sexes. They may not even realize it. Genital warts are an overt symptom of the condition, but those are considered low risk. It's the high risk, and they're HPVs that cause these very serious cancers such as vaginal, penile, anal, and oral. What can you do to prevent HPV or from getting it? Well, abstinence is an obvious means of prevention, but also, talking to your physician about the vaccination, practicing safe sex, using condoms, getting regular checkups, and for women having cervical pap smears. So our next group, our next age bracket is the 40 to 64 years of age folks. And again, you want to look at all these basic health condition, or these health aspects. You want to look at the physical and the general. So what is your height? What is your weight? We do tend to gain a little weight as we age and lose muscle mass. So it's important to stay on top of that, because being overweight and an increased BMI can cause a lot of problems. It's important to do an alcohol check and a tobacco kind of check up and just see what's going on with that. Are there, things that need to be improved? Again, mental health is super important. It's become really top of mind, especially with the pandemic. We need to really talk to our physicians about that and not brush it under the carpet anymore. We don't need to be or find any shame in mental health. It's a very important part of our life. Skin is another thing. People need to have their skin looked at by a dermatologist or your primary care. If you see anything unusual, don't ignore it. Blood pressure in this age bracket needs to be checked annually. Cholesterol, or the lipids in our blood, need to be checked at least every 5 years, and probably more often if you tend to have an elevated level. Diabetes is something you want to look at as well a little bit more carefully. Dental health is just a baseline. Every year, everyone should have their teeth cleaned and examined by a dentist. Vision. Get your vision checked, especially between the ages of 40 and 54, at least every 2 to 4 years. And it's time to start talking about colorectal cancer. If you have a family history, and again, you need to share this with your doctor. Whenever you hear about a family problem, you got to talk to your doctor about it. Because in general, the colonoscopy start at about age 50, but you may need to begin getting, colorectal screenings sooner than that. So between 50 and 75 years of age, you definitely want to start keeping an eye on colorectal cancer. As far as reproductive health, women will need, pelvic exams and pap smears at least every 3 years, and with the HPV screening every 5 years. And mammograms should, again, it's a conversation with your physician, at least every 1 to 2 years. And as far as men are concerned, you need to start talking about prostate cancer screenings. There's PSA tests, and you'll want to talk about family history. And also there's just some people who run a higher risk. If you're African American, you're at a higher risk for prostate cancers. And for both sexes, you want to make sure you're aware of bone health. We start to become a little bit more fragile, a little more brittle. We're a lot more prone to fractures, and a lot of us are, can get osteoporosis. So the possibility of a DEXA scan, talk to your doctor about that. And also, if you're a tobacco smoker, obviously, you want to try to quit, but you might just want to kind of do a little checkup on your lungs. So talk to your doctor about the possibility of getting a low dose CT scan to see how your lungs are doing. And we're back to immunizations. The annual, flu shot, and something I should put on here is the COVID, the COVID vaccine, and that goes for all the different categories. That is definitely important. That, and talking to your doctor about the booster shot. There's also a pneumococcal vaccination, and people are a little confused about that. I just want to be clear that that is not an annual vaccine. Starting at about the age of 65, that's when you should be getting the pneumococcal. But if you have chronic illnesses, sometimes it's indicated for people before the age of 65, and it's usually one dose. But again, that's a conversation with your physician based on your health history. Tdap, which is the tetanus, diphtheria, and pertussis, recommended again every 10 years and maybe sooner if there's like some babies being born or you get a cut or something on your finger. And also, this is the age when we start talking about the shingles vaccine, and that's a 2-dose vaccination, and it's really important to consider getting that as well. So I'm just going to talk a little bit about colorectal screenings. As I said earlier, family history may indicate that you need to have a colonoscopy sooner or before 50, but definitely between 50 and 75, they want to screen you. So these are just some facts about it, just to kind of help you understand what colorectal cancer is. You have a colon and a rectum, and so that's what colorectal means. So you can see from that picture there, that's that whole kind of fleshy toned area of the gastrointestinal system. It's the second leading cause of death in the United States. Apparently there's like 1 in 23 people will develop colon cancer. And it often begins with polyps in the colorectal area, and there are no symptoms. So a lot of people will ignore getting a colonoscopy because they're like, I feel great. Oh, there's no problem. But again, sometimes when you don't have symptoms, there are still problems that are occurring. So you want to get these types of things and all of these things early. You want to find them before they become a big problem and they get out of hand. And again, we want to look at your risk factors, your age, your family history. If you're obese or you smoke, those are also high risk factors for colorectal cancer. And so here's that saying, true or false, but I don't have symptoms. I don't need to be screened. That is not true. You need to be screened. So what are some symptoms of colorectal cancer? Again, maybe this is a little too late. We want to get it before we get here. Symptoms include blood in the stool, unexplained weight loss, your bowel habits could change. You might be feeling some cramping or even some low back pain, fatigue, bloating, and anemia, which means anemia is when you're really pale and you have some like possible blood loss. Prevention, well, you can obviously go to your doctor and get screened by them, but also improving your diet and your lifestyle, a diet that's rich in fruits and vegetables, exercising a lot, staying active, not being sedentary, knowing your family history and sharing that with your physician. High fiber, fruits and vegetables do offer high fiber, but there's, nuts and other whole grains and things like that. So staying away from refined foods that are, come out of a factory and doing a lot more healthy cooking for yourself. That's really important too, increasing your fiber and keeping, your GI healthy. Exercise is very important. Again, being aware of your body and how you feel. If you think there's a slight problem, again, that may be a good a conversation you need to have with your doctor. And there's a lot of different types of colorectal screenings. Obviously, the colonoscopy, that's the gold standard. That is a condition or a screening where you need to be sedated, and they recommend that every 10 years. And again, more often if you have polyps. But you'll hear about other types of screenings like the fecal occult, which is it's a home kit you could talk to your doctor about and start there. And then there's Cologuard, which is another home kit. There's a sigmoidoscopy that your doctor may recommend. And then there's CT colonography, where it's a special X-ray but it's done every 5 years and it doesn't involve being put under. But I'm sure there's a lot of other, ways your doctor can screen for colorectal cancer. So I encourage you to talk to him. I also wanted to highlight Psa screenings because this is another important part of this age bracket. If you're you probably want to start having them when you're at least 45 years of age if you're of African American descent or you have a family history. If you are 50 years of age and older, you definitely want to discuss this with your doctor. So the PSA is for the men. And it's a blood test that measures prostate issues. But it measures, it could, just because you have a high PSA doesn't necessarily mean you have cancer. It could be a number of different things, but it could mean you have an infection or, other problems. So misleading, again, high results may indicate cancer, but they might also indicate you have an enlargement of the prostate or, again, this inflammation, prostatitis, or that you have a UTI. So that's kind of interesting stuff. People sometimes jump to the conclusion that they're getting a PSA and this is going to tell me if I have cancer or not. Well, not necessarily, but it could tell you that there's some other issues going on, and it's important, but your doctor will need to look at your results to determine if where to go next with an elevated number. So what are some things, what are some risk factors for prostate cancer? So age, the older you get, race, African American population tends to have more problems with this condition, family history, and obesity. So things to look for include difficulty and pain urinating, blood in your urine, and any kind of blood in your urine or your semen. That's definitely a red flag. Get on the phone with your doctor. Loss of bladder control, decreased urine flow, a lot of nighttime urination, and some men don't have any symptoms at all. Again, prevention-wise, health, a healthy diet, exercising regularly, trying to maintain a healthy weight, and conversations with your physician. So now we're in the 65 plus category. Again, a lot of the same things will be measured, such as looking at your physical, your height, your weight, your BMI, alcohol, tobacco. But in this age bracket, as we become older and more fragile and feeble, we want to talk about falls and safety, and again, mental health, and having your skin checked for skin cancers. Blood pressure is something you look at a lot more frequently. As we get older, we tend to have more blood pressure problems. Cholesterol checks every 5 years, diabetes, especially if you're overweight, that's something you want to keep an eye on, and dental exams and cleanings annually, at least once or twice a year. And then having your vision checked. And now you also want to kind of have your hearing checked. And then again, colorectal cancer screenings are important. As far as reproductive health, there's a point when women can minimize or have less frequent pelvic pap smear exams. And then mammograms, you want to have them at least every 1 to 2 years. And then I think at a certain age, they will stop. But again, it's a conversation with your doctor based on your health and your family history. And for men, talking to them about prostate cancer and screenings. Bone health, it's a lot more important in this age bracket. Again, we are a lot more brittle as we get older. So talking to your physician about DEXA scans, and also about exercising, because when you lift weights, you build a lot of bone mass and you become stronger, your muscles become stronger. It's kind of important. So talk to your doctor to see if that would be a good exercise for you. And then again, if you're a smoker, you know, talking about your lung health and cancers and things like that. And there may be the possibility of some sort of low dose CT scan. Immunizations, again, we don't want to overlook them. A COVID vaccine, COVID booster, definitely super important. Annual flu shots, you still need to get the flu. The flu and COVID are not the same thing. So be sure to get your annual flu shots. You'll want to talk to your doctor about the pneumococcal vaccine. I mentioned that earlier. This is the age when you start to get it. It's 2 doses. There's a 13 and a 23, and you get one first, and then you'll get a different dose like about a year later. So this is really key. You need to talk to your doctor about that. Tdap, very important. And then the shingles vaccine, if you didn't get it already, you need to, that's very much recommended. So again, a good starting point is to have a primary care physician. It's important for you to keep in mind some of those, things that we talked about or that I shared with you tonight, such as, the blood pressure, the cholesterol, diabetes and such. All those things you need to think about when you go to your doctor. They're probably checking for it already, but it's good for you to know so you can have good conversations with your doctor. It's important for you to also be aware of different screenings in the different age brackets so you can be really knowledgeable and understand why that's important. If a lot of people don't think they need a doctor because they feel great, and that's a really bad reason to not have a doctor and not go to your doctor every year. Because again, sometimes, you don't want to get symptoms. You want to get ahead of the symptoms. You want to prevent things from happening. And that's, again, in a nutshell, what we're trying to communicate tonight. So North Kansas City Hospital has lots and lots of doctors. This is the website that you can go to find a physician. It's the physician referral. I think there's a link there. You can also call the hospital at 816-221-HEAL. And there is a flyer that Shanna will email you that has a list of all sorts of physician specialties for your reference. And so I hope that you enjoyed the presentation. I hope that you learned a lot. I hope that you will take your health seriously. This is all we got. Got to take care of our bodies, our temple, anyway, let me know if you have any questions. And if you do, and you think of them later, you can always email me or call me. And anyway, it was a pleasure to share this information with you. Thank you.
Thank you, Tina. That was very, very informative. Thank you so much. Okay, let's see if we have any questions. So Tina, is there one of those screenings that you get asked about more than the others?
Not necessarily. I think it just depends on the population. No, I don't have any one in particular. I think, I will say not screenings, but vaccinations. People are very confused about vaccines, but screenings, not so much.
Okay. Let's see. It doesn't look like we have any questions yet. So as Tina mentioned, I will be emailing out a link to this to watch it again on YouTube. And I will also have a sheet on there with a list of physicians. So if you guys have any questions, you can absolutely go ahead and email me back at that time too. Oh, wait. Okay. At what age should women start getting a pelvic exam? That's a good one.
Yeah, that's something you need to talk to your physician about. Again, seeing a primary care physician every year, there is no set age. It depends on you, your family history, your sexual history, but you don't want to wait too long. I don't have a specific, I mean, there's the general guidelines, but that's a great question. And you need to have that conversation with your physician for something that's appropriate for you.
I love it. I know as far as women go, I was very confused as to why, we had changed the pap smears and just the exam regulations. So that one stumbled me a little bit whenever it changed. I'm glad that you have it in there. Okay. Well, Tina, I think that's it. So thank you so much.
Thank you. Appreciate it.
Have a
All
good
right, be
evening.
well, everyone.